Welcome to this explainer. So, if you're tuning in right now, odds are you're about to tackle something you've probably never done before, your very first self-injection. And right off the bat, I just want to say congratulations on taking this active step in managing your health. Look, it's completely normal to feel a little bit of anxiety or, hesitation right now, but I promise you by the time we wrap up today, you're going to feel totally equipped, capable, and ready to go. I'm going to be your supportive guide, and we're going to walk through this exact protocol together, step by step, at a nice, calm, steady pace. Trust me, you've totally got this. To give you a highly predictable, totally stress-free roadmap, we're going to break this whole thing down into 4 simple phases. We've got getting ready to start, finding your injection site, performing the injection, and finally, safely finishing up.
Okay, let's dive right into phase 1, getting ready to start.
To kick things off, we're going to use what I like to call the gather first technique. Before you do literally anything else, make sure you have these 3 specific items right in front of you, within arm's reach. You'll need your syringe, an alcohol swab, and your sharps collector. Getting these out right now is absolutely the best way to prevent any of that mid-process panic. I mean, nobody wants to be scrambling around looking for a disposal container while they're holding a used syringe, right? So go ahead, set them up neatly, take a breath, and let's get our hands ready. Our foundational steps here are all about hygiene and comfort. Step 1 is pretty straightforward. Wash and dry your hands thoroughly. Clean hands are an absolute must. For step 2, I want you to find a spot to sit or lie down in a really comfortable position. The key thing here is that you need a clear, unobstructed view of your abdomen. So find a relaxed posture where your back is supported and you aren't, straining your neck to look down. Moving right along to phase 2, finding your injection site. So you actually have a couple of options here. You're going to choose an area on either the right or the left side of your abdomen. The golden rule for this spot, it absolutely must be at least 2 inches away from your belly button. That 2-inch radius gives you plenty of safe, appropriate real estate on either side to choose from.
Now, what's really interesting here is how we can make finding that 2-inch zone incredibly intuitive. When you're looking for that ideal spot on your abdomen, just use a super simple body landmark. Think love handles. Using this completely relatable landmark takes literally all the guesswork out of finding the right spot. It guides you naturally right to those outer abdominal areas that are perfectly suited for a subcutaneous injection.
Once you've visually picked your spot on those love handles, it's time to prep the skin. Go ahead and take your alcohol swab and gently clean the injection site. And here's the really important part. After you've swabbed it, let the area air dry completely. I know, it can be super tempting to rush or try to fan it with your hand, but just be patient. Let the air do its job so your skin is perfectly prepped and completely dry before we move forward. Okay, let's just pause the clinical instructions for a brief second. I want you to take a nice deep breath in and let it out. You are doing great. It is completely normal if your heart is beating just a little faster right now, but look at what you've already accomplished. Your supplies are perfectly staged, you're in a comfortable position, and your injection site is completely clean and ready. You are 100% prepared for this next step, which brings us to phase 3, performing the injection. First things first, go ahead and pick up your syringe. You're going to pull the needle cap straight off. Don't twist it, just give it a firm pull straight off, and then immediately discard that cap right into your sharps collector. Next, how should you hold it? Well, simply hold the syringe exactly like a pencil in your writing hand. This grip is familiar, it feels totally natural, and it gives you the absolute best control. It really shouldn't feel awkward at all. Just hold it the way you've held a pen a million times before. Now, with your other hand, the one that's not holding the syringe, you're going to pinch an inch of that cleansed area on your abdomen to make a little fold in the skin. So the crucial point here is understanding exactly why we do this. Grasping the skin to create this fold actually makes the injection significantly easier and, honestly, much more comfortable for you. It safely isolates the tissue exactly where the medication needs to go. With that skin pinched, gently bring your writing hand over. You're going to insert the full length of the needle straight down into that fold of skin at a 90-degree angle. Just straight down. There are no complicated angles to calculate here, just directly in, perfectly perpendicular to the skin fold. All right, once the needle is in, use your thumb to press the plunger down smoothly until the syringe is completely empty. And when it's empty, you're going to pull the needle straight out at the exact same 90-degree angle that it went in. And once the needle is fully out, you can finally release that skin fold. And just like that, the medication is in. See? The hard part is completely over. You can go ahead and let out that breath you might be holding. But we aren't totally finished just yet. we need to transition smoothly to our final safety steps to make sure we secure that used needle. Which leads us directly into our final phase. Phase 4, safely finishing up.
Still holding your syringe, I want you to point the needle down and away from yourself and away from anyone else who might be in the room with you. Now, push down on the plunger to activate the safety shield. And this brilliantly illustrates a really vital safety feature. By pushing the plunger that final little bit, you literally lock the built-in safety shield into place, making that sharp edge completely harmless.
With the safety shield securely activated, place the used syringe immediately into your sharps collector. Don't set it down on the table, definitely don't throw it in the regular trash. It goes straight into that designated collector. And that officially concludes the physical protocol, cleanly and safely.
You did it. You followed every single step, you maintained a calm environment, and you successfully administered your medication. Taking charge of your own treatment like this, it can definitely feel daunting at first. But look at how straightforward it truly is when you break it down into bite-sized pieces. I really want you to remember this feeling of accomplishment right now. As you look ahead, ask yourself, with this first, biggest hurdle behind you, are you ready to confidently handle your next dose? I know for sure you are. Thank you so much for joining me for this explainer, and take care.